Swartz, and I'm a physical therapist and athletic trainer for STAR Physical Therapy. We are located here in Tennessee, and I started with the McKenzie method really early in my practice, and I've been a certified MDT for a number of years now. I think that the mechanical diagnosis and treatment method is really a great method for assessment of patients and progressing them back to their normal lives. You know, people continue to have pain and musculoskeletal injuries even in the midst of a pandemic. I think that, patients in pain have continued to utilize physical therapy, although our business has slowed down quite a bit. But people use physical therapy to manage pain, whether it's in a clinic or via a telehealth platform. We've had very good success with our telehealth platform and our telehealth visits. Our therapists have done a fantastic job of adapting to that telehealth platform very quickly to keep those patients who are at risk safe in this time. Well, the physical therapy profession, in my belief, is uniquely qualified to assist people, in pain and those with functional limitations. MDT clinicians and physical therapists as a whole are well equipped to assess musculoskeletal injuries and assist patients with mechanical pain. Physical therapists have responded well, by adapting quickly to the telehealth platform, in our community. In our community, we have kept our clinics open to be able to serve those patients who need to come to the clinic as well and who are safely doing so. Direct access is another way to assist patients in pain, and mechanical diagnosis and treatment is a great way to quickly abolish symptoms and also help get a patient back to their normal activity or refer them on to another practitioner if they are unresponsive mechanically. Well, I think primarily you have to be really creative. That's super important to be creative and to keep patients engaged in what you're doing. I think too, it's so important as physical therapists for us to realize the value that we provide to our patients. We make a difference truly in their lives every day by not only just decreasing their pain, abolishing their symptoms, but by educating them. And we have to educate them on how to return to activity safely. We need to educate them on how to manage their symptoms once they get through this episode of pain. We need to educate them on how to sit, stand, sleep without symptoms or without provoking their symptoms. And this is extremely valuable information that we provide as physical therapists to our patients. And we are uniquely qualified to do that with the mechanical method and as physical therapists as a whole to help our patients get back to a normal level of activity. It can be challenging for sure. Just like everybody else in this world, we have children and we're working full time and trying to balance and manage that balance at home between, schoolwork and good physical activity and social interaction that's safe. Because we want to keep our family safe and our community safe, and we want to keep the people in our community who are at risk safe as well. But I think that some safe social interaction, whether it's through the video or phone calls, social media, all those things can help us stay, in a good frame of mind, and which will help us serve our patients better. There are lots of opportunities for education on social media. It's amazing how well, we've adapted through podcasts and video conferencing. Our journals, of course, are available to us. And just, talking with colleagues and trying to, keep that interaction alive. Our live courses, of course, have been, suspended for safety reasons, but we can still continue to learn from each other in other ways. And I think that's, again, great social interaction that's safe, helps us all. I think it's important. We've really tried to stay open in this time, and it's been hard, as you know, our volumes have decreased and surgeries have been shut down. But we feel like it's so important for us to be here to serve, and to serve our patients and those that can come to the clinic and those that we see during a telehealth visit. And so we are just so thankful for, all of our employees and all of the patients and our healthcare workers and our frontline folks that are taking care of things in the hospitals. And we just hope that we can, continue to provide whatever's needed to keep our community going. Telehealth is a new platform for us through the pandemic, and I really appreciate how our clinicians responded, and our patients too. But I do think it was a quick response, and they've adapted with the patients, and on how they're providing good quality value to their patients through a telehealth platform. We do send them copies of each of their home programs or video links, attachments, so that they know exactly what they're doing. And I think the big part of that is while you're having that telehealth visit, to make sure that they're doing them correctly.